Imagine a world where, a failing organ could just be replaced. That sounds like sci-fi, right?
Yeah, almost.
But just recently, surgeons in California did something pretty amazing. The first ever successful bladder transplant.
It's truly groundbreaking, and what's so interesting is how this huge surgical leap connects with something, well, fundamental our bladder health, and maybe surprisingly, how much our diet affects it.
Exactly. So for this deep dive, we're looking at two main things. First, the details on this incredible transplant surgery.
Mm-hmm.
And second, some really eye-opening stuff about how what we eat and drink actually impacts our bladder.
Right.
Our goal today is, well, twofold. Understand what this transplant breakthrough means for people with really severe bladder problems, and uncover some practical ways diet influences bladder health for, well, maybe all of us.
Yeah, definitely. Okay, let's get into it. This transplant. It really is a historic moment in medicine.
It feels huge.
Being able to replace an organ like the bladder, it opens up a whole new avenue for treatment for people whose bladders are severely compromised.
And the patient here, Oscar Lorenzar, 41-year-old father of four, his story is intense.
It really is. He'd had his bladder and both kidneys removed. This was due to cancer treatment and end-stage kidney disease on top of that.
Just unimaginable. And the surgery itself.
Very complex. An 8-hour procedure. They transplanted both a bladder and a kidney from a deceased donor.
Wow, both organs.
Yes, and then came the really intricate part connecting the two.
And the outcome. The big news was he could stop dialysis, right?
That's right. A massive improvement in his quality of life. Huge.
This first success, it feels like it could crack open a whole new field. Are we looking at things like, I don't know, bioengineered organs down the line or more common transplants?
That's a really good question. I mean, it's still very early days, obviously.
Sure.
But this success definitely lays groundwork. It gives hope for future developments, yeah? The focus now is refining the specific procedure, understanding it better.
Makes sense.
But the principles they learn, they could absolutely feed into research on bioengineered bladders, maybe broaden transplant options eventually. It's definitely an exciting space.
Yeah.
But we also have to be realistic. The report flags this. There are significant risks. Short-term, long-term.
Right, like rejection.
Yeah, exactly. And we just don't know yet how well the new bladder will function over, say, 5-10 years, or how long he'll need those immune suppression drugs.
Always a major factor with transplants. The surgeons behind this, Dr. Inderbir Gill at USC and Dr. Nima Nassiri at UCLA, incredible dedication.
Absolutely. Years of work went into developing the technique.
Years.
And, Dr. Gill mentioned this could really change things for a select group of patients, the ones with what he called highly symptomatic terminal bladders, basically bladders that just don't work anymore.
That really drives home how serious these conditions are.
And Dr. Nassiri pointed out this specific transplant was over 4 years in the making. Just shows the level of planning and research.
And it shines a light on why this is needed, right? The current alternatives aren't great.
No, not always. Often, surgeons have to use a piece of the patient's own intestine to create a way for urine to exit the body.
I've read about that. It can cause problems, yeah.
It can. Things like infections, digestive issues. It's a major challenge.
So this transplant avoids all that.
That's the goal. These complications are a big reason why the medical community has been chasing bladder transplants for so long.
So what's next for them?
Well, the plan is a clinical trial at UCLA Health. They want to do more transplants, gather more data, really understand the potential complications. That's how you move forward safely.
Okay, so that's the surgical cutting edge.
Yeah.
Amazing stuff. But now let's shift gears to something maybe less dramatic, but wow, surprisingly impactful. Diet and the bladder.
Yeah, it's a connection that often flies under the radar.
Right. We think diet affects our heart, our weight, but the bladder. So having seen the incredible medical fix, let's look at how we might influence things daily, maybe even prevent needing such drastic measures.
You're absolutely right. It's often overlooked. But certain foods, certain drinks, they really can irritate the bladder, make symptoms worse.
And we're not just talking about rare diseases here, are we?
Okay.
The sources bring up common stuff like incontinence, leaky bladder, having to pee frequently, especially at night. And that condition, interstitial cystitis, painful bladder syndrome.
Exactly. These affect a lot of people. Interstitial cystitis or PBS, it's chronic. causes pain, that constant urge to go.
But it's not an infection.
Usually not. No bacteria involved. The exact cause is still, well, a bit murky. But the idea of bladder irritants is key here.
Okay, explain that.
So these are things in our diet that can directly bother the bladder lining, or they might change how our body makes or processes urine.
Leading to that urgency or frequency.
Or even pain, yeah. It's not just simple irritation sometimes. Certain compounds can actually, stimulate nerve endings in the bladder wall.
Wow. And what's really interesting is that just changing your diet can sometimes be enough.
For some people, yes. The experts we looked at suggest identifying and cutting out those specific irritants can sometimes get symptoms under control.
That's powerful.
And it's not just for people already having trouble understanding these irritants. That's good preventative info, too.
Like Elise Fossnight, the urology specialist, said.
Yeah.
Being aware might help stop symptoms starting.
Exactly. Just knowing what could be an issue is helpful.
Okay, let's name names.
Yeah.
What are these dietary culprits? Coffee comes up a lot. I mean, I definitely feel that extra urgency after my morning cup.
Oh, yeah. Coffee's a classic. It hits you two ways. Caffeine and acid.
Right.
Dr. Fenwa Millhouse, a urologist, explains it well. Caffeine's a diuretic, makes your kidneys produce more urine, so more frequency.
Makes sense.
And it also increases urgency, that gotta go now feeling. Plus, the acidity itself can just, irritate that sensitive bladder lining.
Okay, that tracks.
Yeah.
But what about things we think of as healthy, like citrus fruits, oranges, grapefruit?
Surprisingly, yes. Great vitamins, but high in citric acid.
Ah, the acid again.
Mm-hmm. Dr. Millhouse points out this acid can really bother the bladder lining, worsen pain. She strongly advises avoiding them if you've got an active UTI or interstitial cystitis.
Wow. Okay, noted. Wouldn't have guessed oranges.
Hmm.
So, sticking with acidity, tomatoes, ketchup, pasta sauce.
Correct. Another common trigger, high acidity again.
Seems to be a theme.
It is. Dr. Millhouse says they're a big trigger for bladder pain. And Elise Fossnight compares their effect on urine acidity to soda. Says they significantly irritate the lining.
And cooking them makes it worse.
Apparently so, yeah. Cooked tomatoes tend to be more acidic than fresh ones.
Huh. So maybe a fresh tomato slice is better than marinara if you're sensitive. Interesting. What about processed meats? Hot dogs, deli meats. Feels less surprising.
Right? Those often contain nitrates for preservation and color.
Yeah.
Dr. Millhouse explains these nitrates can turn into compounds linked to a higher risk of bladder cancer.
Oof.
Yeah. So her advice is pretty clear. Everyone should probably limit or avoid them, just as a general health measure, not just for bladder health.
That's strong advice. Okay, moving on. Spicy foods. I'm guessing they're not great for a sensitive bladder.
You got it. They can directly irritate the lining, make symptoms worse. Dr. Seth Cohen mentions they can be particularly activating for people with interstitial cystitis or bladder pain syndrome.
So maybe dial back the heat if you're having issues.
Orthotry, definitely. See if it helps.
Makes sense. Inflammation is inflammation.
Yeah.
Okay, soda's on the list too. I get the sugar, the caffeine, shoot more.
Yeah. Soda's often a triple threat, according to Fossnight.
Triple, okay.
We've got caffeine, the diuretic, which can dehydrate you a bit, make urine more concentrated, more irritating.
Right.
Then the sugar, which boosts urine acidity, maybe even ups infection risk. And then the bubbles.
The carbonation.
Yeah.
Yeah.
The carbon dioxide itself can directly irritate the bladder, causes symptoms.
So even diet soda or sparkling water might not totally harmless if you're sensitive. Good to know. All right, last one here isn't food, but it's critical.
Yeah.
Tobacco.
Absolutely crucial. Not diet, but it's the single biggest modifiable risk factor for bladder cancer. Cannot stress that enough.
How does it work?
Fossnight explains it. Those harmful chemicals in tobacco smoke, your kidneys filter them out.
Into your urine.
Exactly. And that urine sits in your bladder, bathing the lining with those chemicals. Over time, that damages the cells, can cause changes leading to cancer.
The stats are scary, aren't they?
They are. The American Cancer Society says smokers are at least 3 times more likely to get bladder cancer. Smoking's involved in about half of all cases. It's a massive factor.
Wow. Okay, so we've talked a lot about what to limit or avoid. What about positive steps, things we can do through diet and lifestyle?
Well, number 1, and it might sound odd if you pee a lot already, is actually drink more water.
Really? More water?
Yeah. Fossnight explains that more water dilutes your urine. Diluted urine is less irritating.
Ah, okay.
Yeah.
Less concentrated, less bothersome.
Precisely. The key is to sip it throughout the day, not chug huge amounts at once.
Right, spread it out. Makes sense.
Yeah.
What else?
Listening to your own body. Super important. Dr. Cohen calls it a journey of self-discovery.
Because everyone's different.
Totally. What bothers my bladder might be fine for you, and vice versa. You have to pay attention to your own reactions.
So no single bladder diet fits everyone. And making changes gradually seems key too.
Yes, definitely. Dr. Milhouse advises against a massive diet overall all at once. It's too hard to tell what's working.
So like cut out one thing for a week or two.
Exactly. Eliminate one potential trigger, see if things improve, then maybe try another. It helps you pinpoint your specific triggers.
They need patience, right? It won't change overnight.
That's a big one. Patience and consistency. Dr. Milhouse reminds us it can take time for dietary changes to show results in your symptoms.
Okay. And crucially, if things aren't getting better or they're getting worse.
See a doctor, absolutely.
Okay.
Talk to a urology specialist. Dietary changes can help manage symptoms, for sure, but they are not a substitute for proper medical evaluation and advice.
So important. Okay, we have covered a ton today. Started with this really incredible leap in surgery, the first successful bladder transplant. Real hope for people in severe situations.
Truly remarkable.
And then we dove into something closer to home for everyone, how our daily food and drink choices, things we might not even think about, can really affect our bladder health.
Yeah, highlighting those specific irritants, but also those positive steps like hydration and listening to your body.
It's fascinating seeing these two sides, isn't it? Cutting-edge medicine on one hand.
And our everyday habits on the other, both really pointing to how important and complex bladder health is.
It really is. And it definitely leaves you thinking, doesn't it? Thinking about the stuff you eat and drink every day and wondering, how is this subtly affecting my body in ways I hadn't realized?
That intersection of, major medical science and just personal daily choices, it really shows how interconnected everything is when it comes to our health.